In the rhythm of everyday life across Africa, there's a sound many have learned to ignore, a cough. But sometimes that cough is more than just a passing illness. This is SIPO. At first, it was just a cough. Then came the fever, the night sweats, the weight loss, days turned into weeks. SIPO is living with tuberculosis, also known as TB, and he's not alone. Africa carries one of the heaviest burdens of TB in the world. Each year, around 2.5 million people in Africa fall ill with TB, accounting for about a quarter of global TB cases. In countries like South Africa, TB remains one of the leading causes of death, especially among people living with HIV. TB is an infectious disease that mainly affects the lungs, spreading through the air when a person coughs or sneezes. But TB is not just a disease of the body. It is deeply connected to the conditions people live in. TB thrives where life is hardest. Overcrowded living conditions where infection spread easily. Poverty and malnutrition, which weakens the immune system. HIV co-infection, which increases the risk of developing active TB. Limited access to health care, delaying diagnosis and treatment. And sometimes stigma. Because many people fear being judged, they delay seeking help, allowing the disease to spread further. But Africa is not standing still. The fight against TB is one of resilience, innovation, and hope. Across the continent, governments and organizations are working to detect TB earlier. Communities are being trained to recognize symptoms and seek care, and treatment programs are helping millions complete their medications successfully. Over the years, there have been major breakthroughs. These include rapid diagnostic tests like GenExpect that can detect TB in hours instead of weeks, shorter treatment regimens, new efforts to tackle drug-resistant TB, and increased integration of TB and HIV care saving more lives. These developments are changing the story, one patient at a time. If you or someone you know has symptoms like a persistent cough, fever, night sweat, or weight loss, visit your nearest clinic or healthcare provider. Get tested early. TB testing is often free in many public health systems. Follow your full course of treatment, even if you start feeling better. Seek support from community health workers or support groups. Because early detection saves lives. TB is one of the oldest diseases known to humanity, but it doesn't have to define our future.